Welcome to the KN Education YouTube channel. In this video, we will discuss about the histology of the liver. In the previous video, we discussed about the anatomical structure of the liver, isn't it? So, in this video, we will discuss about the histology. So, yesterday we said that there is a right lobe and the left lobe, which is attached by a ligament of falciform, isn't it? And there is a presence of round ligament called ligament of teres. So, we need to see the blood supply and we need to see the how the blood is secreted from the hepatocytes. Okay. So, blood supply to the liver and bile secretions from the liver. So, we need to see, and for that we need to understand about the biliary tree, isn't it? So, the biliary tree where it is exactly takes the hepatic duct. This is the left hepatic duct, this is the right hepatic duct, clear, and it will joins to form a common hepatic duct. After that this common hepatic duct joins to the cystic duct of the gallbladder, okay, and this cystic duct and common hepatic duct joins to form a common bile duct. So this one we discussed in the previous class. In this video, histology of the liver, here very importantly we need to know what are all the important contributions of the vessels for the bile secretions and also for the blood supply to the hepatic cells of the liver, isn't it? So here the hepatic artery. What is this? Hepatic artery. And this one is the portal vein. What is this? This is the portal vein. The portal vein and hepatic artery. Please do remember, the hepatic artery will give the blood to the liver about 25%. Clear? Okay. Then portal veins gives the blood supply about 75%. Clear? Okay. So totally it is 100%. Now it is giving the blood to the liver. Now what to take from the liver? We need to take the bile from the liver, isn't it? Who gives that? So the hepatocytes of the hepatic lobule. Okay. So in the hepatic lobule, we will see at each and every corner of the hepatic lobules, we will see all these three pipes, you can say pipes for better understanding. Okay. So these three, the vessels, they are present at each and every corner of the hepatic lobules. Clear? Okay. So how it will be? So for the bile I used green, for the portal vein I used this one black, and I used the red for the hepatic artery. Clear? Okay. So hepatic artery at each and every corner. Clear? Okay. This is the hepatic artery. Clear? And portal venule. This is the portal venule. What is this? Portal venule. Clear? Portal venule. Clear? Next, another one is the bile duct. This is the bile duct. What is this? This is the bile duct. Clear? Okay. So if you look at carefully, it looks like three important vessels that are present at the corner of the hepatic lobules, which we will call it as portal triad. What do you call? Portal triad. What we call for this? We will call this as portal triad. Portal triad. Clear? Okay. So this is the portal triad. Each and everywhere we are having portal triad. Clear? And at the center of the hepatic lobules, we will having the largest central canal. What is this? Central canal. Clear? Okay. So the hepatocytes in a polyhedral shape where they are arranged, okay, at the from the peripheral to the central, okay, it is arranged. Now very importantly, so we need to look for this before going to the exact microscopic structure of the hepatic lobule. We need to understand what exactly happens at the central hepatic vein. Okay, this is the central vein. This is what? Central hepatic vein. Okay, central hepatic vein. Clear? So those central hepatic vein, how it will carries the blood from the liver cells to the veins. Now we are giving the blood supply. After giving the blood supply, that will all the way goes towards the center of the hepatic lobule, and after there it will drains. Okay, so all the blood is drained to the central cavity, so central vein. So that central vein will make some branches. How it is? See, here one central vein is there and another central vein is there, that will joins to form another lobule. See, here I will write, this is one central canal, central vein, and this is the another central vein. So these two central vein, okay, these two central vein will joins together. Okay, this is one central vein of the one hepatic lobule, is another central vein of the another hepatic lobule. See, here it will joins to form a interlobular vein. What is this? Interlobular vein. Clear? Interlobular vein. Okay, so interlobular vein, this is the central vein. Clear? So it will, so like this the many interlobular veins come and joins to it. Okay, and after joining it, it will become what? The hepatic vein. This one will become a hepatic vein. Clear? So this hepatic vein will drains to where? It will drains to the inferior vena cava. Where it will drains? It will drains to the inferior vena cava. Clear? So from here it will transports to the interlobular vein, and many interlobular vein. This is interlobular vein 1, interlobular vein 2, interlobular vein 3. These all interlobular veins that will drains to the hepatic vein, which is a major vein of the liver. Clear? Okay, this hepatic vein again drains to the inferior aspect of the largest vein, that is inferior vena cava, where it will drains to the right atrium of the heart. Clear? Okay, next. So this is how the exactly from the liver and to the heart. Okay, so it will goes from the liver and to the heart. So yesterday, so in the previous class, I have discussed that how the portal vein is formed, isn't it? Portal vein is formed by the splenic vein, by the rectal vein, by the mesenteric vein, by the gastric vein. These are the things I said yesterday. Okay, that portal vein, all the blood is taken up to, okay, from the gastric artery, from the gastric vein, it will take the some it will take some nutrients, and from the splenic it will take some nutrients, or it will take some blood which is having the hemoglobin and all those things. Clear? So from the mesenteric it will take some nutrients. Clear? So it is having a nutrient rich vein. This one is a nutrient rich vein. After this, when it enters into the liver, it will become a venules. The vein, when enters into the liver, it will become a venules. So that venules is this one. Clear? Okay, I will show you here, so you will understand better. Clear? Okay, so here I am writing the what? Central vein. Okay, central canal. Okay, this is one corner, second corner, third corner. Okay, so in each and every corner there is a presence of what? There is a presence of portal triad. Three things. Clear? So what are they? That is portal triad. So here there is a presence of what? Portal venule. Here there is a presence of portal venule. Okay, at each and every corner I am writing it. And after that there is a presence of what? Bile duct. This one is a bile duct. Okay, bile duct. Clear? Bile duct. Bile duct. After that there is a presence of what? There is a presence of hepatic artery. What it is there? Hepatic artery. Okay, so hepatic artery. And another one, importantly, you need to remember that there is a presence of lymphatic vessel also. Lymphatic vessel also will be there. Okay, lymphatic vessels like this, only small dot it is negligible actually. Okay. Okay, so lymphatic vessels are negligible, whereas other three are under the microscope it visible as a triad. That's why, so if you say, if you want to say with the lymphatic vessel also, then it will become what? Lymphatic system also if you include, that will never call as a portal triad, we will call it as portal tetrad. Okay, if we call for this we will call it as portal tetrad. Okay, what we call portal tetrad, but nowadays we will call it as what? Portal triad, because of it is highly magnification. In the high magnification you will see the three things, the three ducts are very important for that purpose. Okay, so portal triad. So this portal triad, what it contains, I will write here. So portal triad contains first one, that is bile duct. Second one, it contains portal venule. You should write venule. Third one, it contains the hepatic artery. This one, hepatic arteriole. In this area, this is arteriole. Okay, this is artery. The branches of the artery is the arteriole. Hepatic arteriole. Clear? Okay. Now there is a presence of the channel from the central vein to the corner. Okay, there is a channel. Okay, there is a channel, and very importantly, at peripheral area it is resistant, and at this area it is narrow. Okay, so in this area we are having what? This canal will be called as sinusoid. What we call sinusoid. Here what happens, the 25% of blood is drained here. Okay, and from the portal venule 75% of the blood is drained. Okay, so the drained blood that will gives the what? So from the portal venule, it contains what? It contains the nutrients. From the hepatic artery, it contains the oxygen. Okay, from the hepatic artery, see, oxygen is given by the hepatic arteriole, and portal venule gives the nutrients to the hepatocytes. Sir, where is the hepatocytes? Hepatocytes are present here only. Okay, okay, it arranged like a plates. Okay, it is arranged like a plates, which is having a rich mitochondria. About one hepatocyte will contain more than 8,000 mitochondria it contains. And here in the sinusoid there is a presence of what? Portal vein, and also portal venule's blood, and also hepatic arteriole's blood. Now all the way at the peripheral area, it will gives the oxygen for this zone. At the peripheral zone, it will receives the oxygen very fastly, but when it goes near to the central canal, it will become like a ischemic, or ischemic means lack of oxygen towards the center, and near the center there is a highly oxygen rich. Okay, so up to here the oxygen will be there, but near to the central vein there is a less oxygen. So in this area 98% of the saturation. In this area it is already it is reduced to 94 to 93. Okay, that is the thing. Clear? Next, in the hepatic central canal, it will gives the blood as a deoxygenated blood. Now, so oxygen is given to the this hepatocytes, and the hepatocytes will give the carbon dioxide to the sinusoids, and that carbon dioxide will be what it will goes with the blood RBCs. Clear? Now, in the sinusoids there is a specialized macrophages, or you can say that macrophages name is called Kupffer cells. What we call Kupffer cells. Here I will write Kupffer cells. Okay. So what is the use of this Kupffer cells? Kupffer cells are present at the sinusoids. This one we will call it as sinusoids. Okay. This canal will be called as sinusoids. Okay. Sinusoids. This sinusoids contains what? Kupffer cells. These Kupffer cells will identify the old RBCs, and it will make the degeneration of the RBC. Okay. After degenerating RBC, it will contain heme and globin, and takes up the from it will takes up the bilirubin. Clear? So now, so that is different. Now we need to understand about you understood about the Kupffer cells. Okay. Kupffer cells also make another function, that is Kupffer cells destroys the bacteria, or it identifies the toxins which are which is not at all required to the body. For that, see, in the Kupffer cells it contains lot of lysozymes. Okay, it will lot of lysozymes it contains, where it will breaks, and it will makes the it will breaks all the toxins, or it will breaks the bacteria. So thereby it will acts as a immune power. Okay, it will act like a immune for the liver. Okay, it is the inflammatory macrophage which is present in the hepatic lobule. Clear? So this hepatic hepatocytes, see, by mistake I have written a green sketch for this hepatocytes, so that I will take a pink color for the bile. Don't be confused here. So I am writing the bile in between. Okay, in between this side. So here there is a from the bile duct, it will gives what? It will gives the bile canaliculi. So this is the bile canaliculi, and it will never reaches, and it will never merges with the central canal. It will comes back. Okay, this will comes back. See, easily I would like to say, the flow of the blood from the peripheral to the center is called the centripetal flow. Centripetal flow. What you call this flow? Okay, this flow. Sorry. This type of flow will be called as centripetal flow. Centripetal flow. In the centripetal flow, what happens here? Actually the blood is flowing from the peripheral to the central, that is centripetal. But in the bile, what happens? Okay, here I am writing the bile duct. Okay. So this bile duct which will receives the bile. Who will gives the bile? First of all, the bile is given by the hepatocytes. The hepatocyte secretes the bile, and it will flow away from the central canal. It will flow away from the central canal. So this one will drains into the bile duct. Clear? So the flow of the bile from the central canal to the peripheral aspect of the bile duct. So such flow will be called as centrifugal flow. Okay, this is centripetal flow. This one is centripetal flow. This one is centrifugal flow. Centrifugal flow. Centrifugal flow of bile. Centripetal flow of blood. Okay, so like this, at each and every corner we are having what? The same sinusoid. Okay, same sinusoid we are having. Same sinusoid we are having. Okay, so in between the sinusoid and hepatocytes there is a space. Okay, so the space between this is the space. Okay, the space between the hepatocytes and the sinusoid is known as space of Dis. What I said? Space of Dis. Okay, space of Dis. In the space of Dis we are having the very important cells called stellate cells. What do you call? This is called stellate cells. What is this? Stellate cells. Stellate cells. What is the function of the stellate cells? Actually, the function of the stellate cell which is having the stores, it stores the vitamin A. Okay, it stores the vitamin A. So this stellate cell is having the vitamin A. Clear? But whenever there is a Kupffer cells is getting attacked by any bacteria, or if it is trapped the bacteria, okay, that time, so there is a infection will be there, or we can say the inflammatory mediators. The inflammatory mediators, one which is produced by the Kupffer cells, will stimulate to the stellate cells. When it will enters these mediators of the Kupffer cells, inflammatory mediators of the Kupffer cells enters into the space of Dis where the stellate cells are there. So that inflammatory mediators stimulates the stellate cells. Okay, clear? Okay, it will become what? Stellate cells. Now it will produces what? It will produces the myofibroblast. It will produces the myofibroblast. This myofibroblast will become what? This myofibroblast at the time of the infection or at the time of the inflammatory mediators stimulation, this myofibroblast will secrete more collagen. Okay, it will secrete more collagen. Okay, now you understand collagen is that will makes the fibrosis, or you can say there is a scarring over the any wound if it is there na, so that collagen formation, the trap. Okay, so likewise more collagen formation at the space of Dis will constrict the sinusoids. Okay, so here also space of Dis are there, here also space of Dis are there. Okay, and here there is a presence of what? Here there is a presence of hepatocytes. Clear? Hepatocytes are there. Now both side of the wait, okay, both side of the space of Dis will have the more collagen. That time it will constrict the sinusoids, so thereby there is a lack of blood supply to the liver, cells. So that will become what? There is a scarring, or we can call it as the cirrhosis of liver. What do you call? It will become a scar and nodular, and it will become an enlargement. So due to the enlargement it will be called as hepatomegaly also. Enlargement will be called as hepatomegaly, and scarring and nodular thing, degeneration and destructive of the hepatic lobular will be called as cirrhosis of liver. Okay, cirrhosis of liver nothing but fibrotic. Okay, so this is the pathological condition of the pathological condition of what? Liver. Okay, pathological condition of the liver, where the microscopic structure, from the microscopic structure I explained. Clear? Now, sometimes that maybe the hepatitis B infection or hepatitis A infection. So due to the infections, these may have acute or this may have the chronic. Very importantly, the cirrhosis of liver, if it occurs, that will be called as irreversible. Okay, it's a irreversible cause. Okay, irreversible disease. Clear? Okay, so thereby it will cover. See, this liver is covering the covering what? The peritoneum cavity, interperitoneal cavity. Okay, there is a peritoneum, visceral peritoneum and also parietal peritoneum. The peritoneum which is near to the the peritoneum which is near to the liver is called visceral peritoneum. The peritoneum which is away from the peritoneum, away from the liver, sorry, the outer peritoneum which is away from the liver, it is called parietal peritoneum. Clear? Okay, so the capsule which covers the first capsule will be there. Later on there is a presence of visceral what is this? Visceral peritoneum. This one is the parietal peritoneum. Inner there is a covering of what? Glissen's capsule. What is this? This one, the orange color, you should think that is Glissen's capsule. Okay, Glissen's capsule. This Glissen's capsule, and also it covers what? Visceral peritoneum. And again there is an interperitoneal cavity, and after that parietal peritoneum layer. Okay, so so I will write here, you will understand. Okay, this one is the what? Visceral peritoneum. This one is the parietal. Clear? Parietal and visceral. I hope you understood this one. Okay, this is all about the histology of the liver. So we discussed about the right lobe, left lobe, and where it is attached, where it is covered by the Glissen's capsule, and it is covering layer of the liver is peritoneum. Of course, it is abdominal cavity, means abdominal organ, means it will covers with the peritoneum only. The bare area of the backside posterior aspect of the liver, which direct connection to the diaphragm, inferior border or inferior surface of the diaphragm with the ligament called coronary ligament, as I said in the previous class. Clear? So inferior vena cava. So here there is a gallbladder. Quadrate is holding the gallbladder, and caudate is holding the inferior vena cava. Clear? So there is a very importantly, you need to remember this one. Okay, portal triad. What are the three important ducts or vessels for the portal triad? Means bile duct. Okay, this one is the portal venule, hepatic arteriole, you should say that. See, this one, that one which goes inside. Okay, this one not goes inside, so it will takes from the inside. Okay, so this one will be called as canaliculi. What is this? Bile canaliculi. Okay, this one is the bile duct. Now, so after that bile duct, if it comes, if the lobule is present in the left side, it will takes the bile duct. Okay, here I am showing the bile duct. Okay, it will gives to the left hepatic duct. This is the left hepatic duct. This one is the right hepatic duct. From this lobule. Okay, here there is a what? There is a presence of bile duct, and it will gives what? The bile. And later on, this right hepatic duct and left hepatic duct it will use the common hepatic duct, and it will use the common bile duct and secretes to the duodenum. Now very importantly, so extra secretions of the bile will be stored in the gallbladder. Clear? Extra bile will be stored in the gallbladder if it is not in use. When it is in use, when there is a food is present in the stomach for 4 hours or 2 to 4 hours, then if it is ready to enter into the duodenum, that time bile will secrete for the purpose of lipid digestion, or we can call it as fat digestion. Clear? Okay, so this is all about the histology of the liver. I hope you understood this microscopic structure of the liver very well. So like this, everywhere you need to write this is all about the microscopic structure of the liver. I hope you understood well. Thank you for watching this video.